Are you getting knee pain in the front of your knee? A lot of people are concerned that often the knee pain is coming from their joint, but for a lot of people, it's actually the tendon. So here's how you can tell the difference. If you're getting knee pain at the front of your knee, there can be a couple causes. It can be sometimes from the joint itself, what we call intra-articular. It can be from the fat pad, which is at the front of the knee, or sometimes it can be the tendon. Now, to tell the difference, for a lot of people, especially if it's been an acute overload and it's recently come on with a change in activity, it's very often going to be a tendon, which we call a tendinopathy. Now, to tell the difference, if it's going to be inside the joint like meniscus or something like that, usually that's associated with a traumatic event, like you had a contact or a twist or something of that nature. And usually that's going to be more uncomfortable when you're in a deep position, like a deep squat, where the joint is very tight, or when you're rotating. The tendon, on the other hand, is going to be more with loading through that specific tendon. So things like going up and down stairs, going for hikes. And the other telltale sign for tendinopathy is that they'll usually get better as they warm up. So it'll be sore and uncomfortable when you first start, like maybe when you first start a run, but then it'll get better over time. If it is a tendinopathy, the best thing that you can do, although it seems counterintuitive, is to actually add a lot of load to it. So the worst thing is to actually stop and rest. And this is why it's important to get a proper diagnosis so that we can know exactly how to load it and how to load it appropriately across the rehab time. So if you're having anterior knee pain, then try these out, see if you can figure it out. Otherwise, come talk to us and we'll